Alright, we're continuing here with the mobilization of the foot, and at this point we're going to be looking at talus navicular. The navicular is the cornerstone or keystone of the arch of the foot, especially with the medial arch. And what we're looking for in this position, I'm going to take the position that if the patient has a flat foot, we're going to do a dorsal glide to the navicular with respect to the talus. So if he has a flat foot, what is happening is the rotation component that takes place with navicular is rotating in a direction that is making the arch become fallen or compressed. So we're going to try to increase that arch or loosen those ligaments by doing a dorsal glide of navicular on talus. And we're going to perform this in a prone position. Once again, talonavicular mobilization. So with this position, I'm going to take the patient and I may scoot you down a little bit further this way so that your anterior side, dorsum side is on a towel. So I'm looking at what I'm doing is I'm bracing a towel right in here on this side between tibia and talus. So I've got a towel and I have a way of mobilizing and stabilizing. I'm going to use the calcaneus to put pressure onto the talus against that towel into the table so he becomes stable so that I can mobilize the navicular on the talus from this position. So it's going to look kind of like this. I want to look at good body mechanics when I'm doing it. Make sure one leg is forward, one leg is back. I grab a hold of the subtalar or calcaneus. I'm going to be palpating. Once again, you should be able to find navicular very easily. He's that first protruding bone. Once I come off of talus, he's right here. And I'm going to palpate that with my thumb, but I'm not going to use my thumb. I'm going to use my proximal thumb or hypothenar eminence to do the dorsal glide. But first of all, I'm going to get a hold of the calcaneus and I'm going to lock him down and pushing calcaneus onto talus into the towel and therefore making him stable. At this point, I'm going to do a dorsal glide on a lockdown talus. Dorsal glide of navicular. This will help with the patient that has the flat foot or fallen arch. Okay, the next position we're going to go to, this would be for a patient that's coming in with a high arch or pes cavus as it's called. So with this position, the patient's going back to the chair. We're going to have him bring his foot up onto the edge, and the motion that I'm going to have to perform in order for this mobilization to take place is I'm going to come onto the talus and I'm going to lock him down and I'm going to try to grab with my index finger around the plantar side, plantar surface of navicular, and I'm going to do a plantar glide with a rotation component. So it's kind of looking like this. Plantar glide with rotation. Okay? So on the patient, it's going to look this way. So I'm going to put him onto the edge. Doesn't hurt to have a towel in there to support him. Once again, the patient's knees 90 degrees, his hip is about 90, and I've got him in a neutral position with the ankle talocrural joint. Come off the talus, find navicular. He's right here, protruding. My finger is going to wrap around that position, and I'm going to stabilize. Calcaneus is up against the edge. I'm going to stabilize talus against the calcaneus. Stabilizing here, and notice where I'm putting my thigh also as a way of bracing and holding that all in place against the stabilized edge of this table. Once I keep talus stabilized, my motion is going to be a plantar glide with a rotating upward motion. This will help to decrease the high arch.